So we do a few things different here in our office when you come in for a cleaning. We have incorporated a process called LBR, or laser bacterial reduction. What LBR is a little diode laser that we place in the gum pocket around each tooth, and it decontaminates the pocket. So prior to your cleaning and us getting in there with instruments and stirring that bacteria up, we kill all the bacteria. Because there is such a strong link now between periodontal disease and the bacteria in our mouth and heart disease, respiratory infections, low birth weights, and diabetes, it's very important to kill that bacteria, because the last thing we want to do is stir it up and get it down into the bloodstream, because once it gets into the bloodstream it can travel to all those different areas, and that's something we absolutely want to avoid. So LBR is done at every cleaning. It lasts about 90 days, but like I said, we want to kill the bacteria before we get in there and stir it all up. It is not painful. All we do is we take this laser and we place it in that pocket around each tooth. If we hit a large pocket of bacteria, you can feel a little bit of warmth, but that's it. Otherwise, it's completely painless, and it only takes about 3 to 5 minutes. Diagnodent is a tool that we use to also find cavities very, very early so that we can reverse them rather than fill them. Diagnodent is a laser that we place on the tooth, and it finds cavities in its earliest stages. It finds areas of tooth that are not as dense, and so we know that a cavity is forming in its absolute earliest stages, so we can apply fluoride and reverse that cavity and remineralize the tooth. One thing you definitely don't want to hear when you have a Diagnodent is this. That's not good. But most of the time, it's not like that. We just run, it's a very painless procedure. It's just a little laser light, and we just run this over the tooth structure, and if we get that noise, we know we have a cavity. But we rate it by the numbers here, and anything over a 30 needs to be treated, whether it's fluoride or a filling. So one thing we use in this office is digital x-rays. Digital x-rays are really important in our philosophy here to reverse cavities rather than fill them. A couple of really great things about digital x-rays are that they're much more comfortable for you and they're a lot faster. If we have a x-ray that doesn't turn out, we see immediately because it's an immediate process. The other thing, you'll remember regular x-rays, they're about this big. This is what I get to see when I take a digital x-ray. It's very large and I can find cavities very early. The other thing is the radiation. The radiation from digital x-rays is much, much less than regular x-rays. You actually get more radiation walking outside than you get for a full set of x-rays here in the dental office. Another amazing tool that we have here in this office is called Velscope. Oral cancer is becoming a big, big problem in this country. We have linked oral cancer to the virus HPV, human papilloma virus. This is a sexually transmitted disease that's really becoming very widespread. They're actually connecting it to many, many cancers, including cervical cancer. Well, Velscope is a great tool for us to detect oral cancer in its earliest stages. All Velscope is this light that we place in the mouth, and when we see something that glows a different color, we know that there's something abnormal going on underneath the tissue. And at that point, we refer you to an oral surgeon, and a oral surgeon takes a look at it, and we'll either biopsy it or just keep an eye on it for a few weeks. Perio Protect is an FDA-cleared medical device, and really it's just some soft trays that are custom fit for your teeth, and it helps you deliver some medication underneath your gums to kill all the bacteria. And really, it's a great option, especially for people that have had periodontal surgery or are going to need periodontal surgery.